Hi, my name is Sharon Kowalchuk, and this is the story of what inspired me to become a nurse. Always told this story to everybody in a very flippant way that I really wanted a Volkswagen Beetle. So in order to get the Volkswagen Beetle, I convinced my parents that I would go to Queens College and become a math teacher because it was very inexpensive tuition, and they bought it and helped me buy this car, and all I wanted to do was drive, really. So I went to college night at my high school, and there was a man in a room talking about Hunter College. Well, that was part of the CUNY system, so I knew it was cheap, and I had the car, and he said, "You get a free room in the dorm in the city if you become a nurse." I was like, got the car, can get away from my parents, live in the city. I guess I can become a nurse. So off I went, and I always thought that was my story. Maybe about 10 years ago, my director of nursing had tickets to see these famous theorists. One of them was Mary Manthe, who was the mother of primary care nursing. And there were two other people that I admired, Jean Watson, who has a theory of caring, and Kristen Swanson, sorry. So Mary told this, they all told the story of why they became a nurse. And the story that stuck with me was Mary's story. And Mary's story was that she was a child in a hospital, and I guess she had some chronic diseases as a child. And the nurse came in, her parents couldn't always visit, she was far away from home, and a nurse came in and colored in her coloring book, which she still has today, okay? She's probably in her 70s right now. And she says that's what inspired her to become a nurse. So I thought, I have a story like that, but I never realized that was my story. I was around 4 years old, and I had to have hernia surgery, which was congenital and unusual for a girl. And I went to the hospital with my Gerber baby, very fitting. And Gerber came with me everywhere. And she even came to surgery with me. That's what the doctors told me. So I get back and I'm in the pediatric ward, which I still have a visual of in my head. And Gerber falls to the floor. I must have turned. And I guess I hit the button. The nurse comes in, and I said, "I need my doll. I need my Gerber." And she said, "You don't need that stupid thing." She really did. I couldn't believe it. Even as a 4-year-old, I was like, what? So in my head, at 4, and I can remember it now after hearing Mary's story, that I really thought no child should ever suffer this, and I'm going to make sure of it. So after all of this, I said, oh my God, I've been a nurse for 30 years and I just figured out what my story was. So that's my story, and I think that I've always looked at who really, really needs help and kindness. And I found my spot in psychiatry because when I graduated in the 70s, nobody wanted to go into psychiatry. And I found that those were the patients. I graduated from Bellevue, and that's where I went to work, and those were the patients that were so underserved. 70, 80 patients on a unit with one nurse and 2 LPNs and maybe a few techs. And that became, where I wanted to be. I knew it, but I was pretty far into my education before I realized that was it. But that was it for me. I never wanted to leave, and I never wanted to be any other kind of nurse. And I have always been happy in what I've done.